Okay. Good afternoon. Good day, class. Good evening. So, ang ginobra natin sa mga summer, no, nag-enroll kita sa Research 1, Nursing Research 1. Okay, so ini ang aton itakol is module number 1. Okay? Susundo naton ang lecture sa module 1, no, and then after this istoryahan naton ano ang mga requirements naton para matapos ang research chapters 1 to 3. Okay, so um, what is nursing, no, what is nursing research? So, nursing research is a formal, structured, and systematic process of studying things that matter to the nursing profession. It's not just casual observation, it's scientific. So, researchers gather data carefully, analyze it objectively, and draw conclusions that can improve how nurses work, teach, and even manage hospitals or health systems. For example, suppose nurses notice that elderly patients are more prone to falls at night, no? Prone to falls at night. So instead of just guessing why nga abi, they can conduct nursing research. So they can collect data about patient activity patterns, staffing levels, lighting, or medication timing, and find real solutions to prevent falls. Okay. Now, we have definitions, no, sang by the experts. Na according kay Naisa Y. Domi, I'm not sure if I pronounced this correctly, in 2008, says nursing research analyzes important nursing phenomena systematically and objectively, 'di ba? So, example abi, studying how COVID-19 affected nurses' mental health during the pandemic. How about kay Waltz and Bossel, 2001? Anong definition niya? So, ang definition niya, it emphasizes rigor and intensity in solving problems or finding new facts. So, examples ni investigating new techniques to reduce hospital-acquired infections. So, or HAIS. So, through better hand hygiene practices. Another, NCNR focuses on testing knowledge that guides nursing practice. So, for example, researching whether a new wound dressing speeds up healing better than traditional nga pag-dressing. Okay? How about kay Pole and Beck in 2012? They highlighted developing trustworthy evidence. So for example, systematic studies on effectiveness of telemedicine for remote patient care. Okay? So, amo na mga few definitions of nursing research by the experts. Now, let's go to the goals of nursing research. efficiency and effectiveness in care. So, nurses use research findings to care for patients faster, safer, and better. So, for instance, research shows that early rounding reduces patient falls and improves satisfactions. Okay, number two, demonstrating nursing's worth to society. So, research highlights the essential role of nurses. For example, studies showing that hospitals with higher nurse to patient ratios have lower patient mortality rates. So, amo ni, no? And then, how about sa dalanggid ha? So, identifying, implementing, and evaluating effective healthcare modalities. So, research helps find better treatments and approaches. So, for example, finding that music therapy reduces anxiety in pre-surgery patients. Okay. So, in providing evidence-based quality care, okay? So, nurses base their decisions on proven evidence, not guesswork. Okay? Example, using evidence-based guidelines for pressure ulcer prevention. So, turning immobile patients every 2 hours. Okay? Now, let's go to roles of nurses and research. Tagaan ka mo with examples. No. Number 1, principal investigator. So, leading the whole research project. So, for instance, a nurse professor are conducting a study on stress management techniques for ICU nurses. Okay? So, member of the research team helping design, collect, and analyze data. Okay, for example, staff nurses assisting in a study about new patient monitoring equipment. Then we have the identifier of research problems. So, you spotting issues that need studying. In a way, class, that's what research do. We look for problems, no? Para nga maobra naton yung anong solusyon na pwede. 'Di ba? So, kung hindi kita kaspot sang problema, wala kita sang i-research. 'Di ba? So, for example, a nurse notices patients with dementia get agitated at specific times and suggest research. Why? No, why the patients with dementia get agitated at specific times? And this problem suggests research. Okay? So, evaluators ang research in nursing, critically reading and judging research before applying it. So, for example, deciding whether a newly published study about IV insertion techniques is strong enough to change practice. Okay? Next, user of research findings. So, applying research into daily work. So, a nurse adopting a new post-operative mobilization protocol after reading strong evidence supporting it. So, we also have the patient, client, advocate during studies. So, protecting participants' rights and welfare. So, making sure patients volunteering for a medication trial truly understand the risk naintindihan nila yung mga participants ng mga patients nga nag-volunteer for the trial. Okay? But there is patient-client advocate during studies. It is protecting the participants' rights and welfare. You have to let those respondents know or those patients know who volunteered for the research. Okay. Subject participant in studies. Sometimes, nurses themselves are participants. For example, joining a study evaluating stress levels among healthcare workers. So, ang purpose of nursing research, no, gina identify niya, there is identification. Research find out what problems exist. Ano ang naga-exist nga problema para sa researcher nga mag-create sang iyang study. So, ma-base ina kung ano ang problem. Okay. So, identifying high stress, for example, levels in newly graduated nurses. So, that's the problem na gusto mo nga, that's the question na gusto mo masabat. You want to identify the high stress level sa mga bag-o nga graduate nga mga nurses. So that could be a research, no? Nga pwede mo obrahon. Now, we have the description. So, research describes what's happening. Ano ga katabo. So, describing the symptoms and emotional reactions of patients receiving chemotherapy. Okay, example na. Now, we have the exploration. Research explores situations or phenomena more deeply. No, exploring how patients from different culture manage chronic pain at home. Okay, so research explains why something happens. For instance, no, if you are in the nursing industry, explaining why nurse burnout rates are higher in emergency departments compared to medical surgical units. Okay? Now, we have the prediction and control. Under the prediction, we are anticipating what could happen based on research. So, this is where predicting the higher nurse staffing levels will lead to better patient recovery outcomes. Siyempre, di ba, sa diyan mo, kung mas damo ang staffing, higher nurse staffing levels, makalid siya sa better patient recovery kay maakuparan niya. Di ba? So that is under the prediction, anticipating that could happen based sa research. Example, amo ng results ng research mo. You predicted it. Kung mas damo ang nurse staffing level, makalid siya sa better patient recovery because of the care that the nurses can give. So, we have the control. So, putting strategies in place to prevent bad outcomes. So, example, implementing scheduled breaks to control fatigue among night shift nurses. Okay. So, nursing research guides real-life nursing practice. So, it ensures nurses don't just rely on what's always been done, but instead use tested and proven strategies to deliver better, safer, more effective care. So, it helps prove the value of nursing to society, identifies problems, explains causes, predicts outcomes, and controls risks. So, all with the ultimate goal of improving patient health and strengthening the nursing profession. So, what I'm encouraging you to do is to look for a title or for a study with an objective that helps um, discover sang aton nga pwede naton matun-an sa nursing community. Okay, ano ang mga problema dira? So you look for problems there nga pwede nyo nga i-base ang inyo research. Okay? So that's the end of module 1.